Greetings, friends. Thank you for listening to the Hands of History podcast, a production of the Society of Massage Archive, the only nonprofit that is dedicated to preserving the history of massage and bodywork. Because of people like you, the Society of Massage Archives exists. History isn't just something that we store away, it's something that we can learn from. When historical knowledge is integrated to education, it deepens understanding, sharpens critical thinking, and strengthens professional identity. Thanks to our Founders Club, 50 individuals who stepped up to help build our foundation, SOMA's work is still underway. That support is helping connect the past to the present through educational outreach, bringing history into classrooms, conversations, and continuing education. But meaningful education doesn't happen by accident. It takes attention, resources, and ongoing support. We are building tools and opportunities that help practitioners and students alike understand not just what we do with our hands, but where it comes from and why it matters. As a 501c3 nonprofit, SOMA is working to ensure that massage history becomes a living part of education, not just an afterthought. If you believe that understanding our past strengthens the future of our profession, we invite you to become a recurring contributor. Whether it's $20 a month or any amount that feels right to you, every gift helps to sustain SOMA's educational mission year-round. Because history doesn't teach itself. People have to bring it forward. Learn more about becoming a recurring supporter today at societyofmassagearchives.org. Thank you. The views and opinions expressed in this podcast do not necessarily reflect those of the Society of Massage Archives. These views and commentaries represent the recollections of both the hosts and the guests, and as such, are subject to the occasional slight inaccuracies. The content here is for informational and educational purposes only. You should conduct your own historical research when determining the veracity of any of the statements made within.
Greetings, and welcome to the Hands of History podcast, a production of the Society of Massage Archives, where we delve into the rich tapestry of massage therapy's past, explore its evolution, and share the stories that have shaped this vital practice. Today is Monday, April 27th, 2026. I am your host, Kirby Clark Ellis, and I'm joined today with Dr. Sarah Fogarty. Sarah Fogarty holds a Diploma of Remedial Massage and has been in practice as a remedial massage therapist and acupuncturist for over 26 years. She currently works in a clinic with a women's health focus. She completed her master's in 2005 and in 2011 was awarded her PhD from the Department of Health Sciences at Victoria University, Australia. She is an adjunct fellow at Western Sydney, Australia, and has published over 50 papers, including papers on pregnancy massage, massage and miscarriage, bereavement massage, and fertility massage. She has presented her research at both national, international, and local conferences and massage organizations. Sarah was awarded a Massage Foundation Research Grant in 2022 for her research on pregnancy massage after stillbirth and is only the second recipient to be awarded the grant outside of the United States. She is currently serving as an associate editor for the International Journal of Therapeutic Massage and Bodywork. Greetings and welcome, Sarah.
Hello, it's lovely to be here.
I'm so excited to get to have this conversation with you. I hear your name thrown out every once in a while, so a little bit of a deeper understanding of you and your work. I can't wait to jump into it. I want you to start, though, at the beginning. Tell me what pulled you into the world of massage therapy.
Probably like lots of people, that concept of wanting to help people. To help people. And it was something, I guess, that resonated a little bit between the place that I studied offered both acupuncture and massage. So that seemed like a really nice thing that I could get a little bit more bang for my buck than it being just particularly a massage place. So I didn't have to choose between one and the other. It wasn't the best idea I had at the time, but I could study them. I could study them concurrently. It sort of didn't work quite how I thought it was going to. I ended up doing more of the acupuncture subjects first because there were a lot more prerequisites, and the way they ran it wasn't really designed that you could, for people to do two at once. It was sort of designed that you do one or the other. So I did more of the acupuncture first and then finished up with more of the massage.
So if it wasn't designed to do both simultaneously, is there any story that you could share that really highlights how that didn't work out perhaps in the best way for you?
It felt a little disjointed, I guess. So when I was doing the acupuncture, there were more prerequisites and you end up doing point location 1, point location 2, you end up with the same people. So you end up with that same group of people, you get to travel along that course together. Whereas with the massage, because I was just dipping in and doing some of the subjects did overlap, so that was useful. But some of the more massage specific ones were I would do like one or two in a semester. And so I wasn't with the main group of people that were like, I didn't have every class with all the people that were going to complete their course in 2 years. So it took me 5 years to do to do them both together.
Okay.
So in the end, I ended up moving. Yeah. I mean, it seems like a good idea at the time, and obviously the place that I learnt didn't dissuade me from spending more money there. Um,
Of course.
but it probably, when I look back, it probably wasn't ideal. But I mean, I got that final year anyway, so I just had to redo some of the subjects, which was fine. It was probably, I probably got a better, more specific massage education in that last 12 months because the place that I went to only did massage.
Cool. Let me ask you, a desire to help people. Is there anything that really set you on the path to fulfill that in massage and acupuncture specifically?
Oh, not I guess specifically massage. It's not like I had a massage and went, this is amazing. I'd given a few people a couple of massages and they said some positive things about how it was nice, and I felt like I was okay at it, which always is helpful.
Sure.
And it was probably the acupuncture. I probably was more drawn to the acupuncture initially as that whole body medicine, and I guess that alternative way to help people. It wasn't because I don't. No one had had acupuncture that I knew of. No one around me had had acupuncture. My mum had some stuff that needed Western medicine and had good Western medicine care. So it wasn't like we'd been failed by a system or anything else. It was just that desire to, that draw to sort of help people. And I guess more of a holistic way. I felt like that acupuncture was holistic. I felt like massage was holistic. And not to say that GPs don't work in a holistic way, because they do a lot of overall, things from, pill prescription to, sending people off and doing all sorts of stuff. So they're quite broad. But I think that broadness, ironically, was probably what drew me in. And the irony was I actually preferred the narrowness of massage. I find acupuncture quite difficult in that sense that one symptom, can be multiple different pathologies, and it's lovely. The fluidity of that is lovely, but sometimes it's quite hard to practice it. You feel like you're chasing your tail a little bit about, oh my gosh, was it chi stagnation? Did it come from spleen deficiency? Like you feel like you're sort of wandering around in the endless possibilities if you're not, particularly for chronic health stuff, trying to find that thread that helps someone. Whereas with massage, I think there's a more simplistic boundary. We deal with muscles. I don't do internal organs. Or those sorts of things. So yeah, so that's how, even though I started with probably the acupuncture, I ended up just by default, a couple of reasons, I ended up working in a sports medicine center I wasn't allowed to do acupuncture. And I worked at a football club where acupuncture wasn't a big thing. So similar, I guess, to your NFL style club, I ended up working for national teams in the national competition. And so that massage, I guess, once I finished my course, ended up being very job dominant. So the massage bit was very job dominant, which probably also then helped swing a little bit, because when you first get out of, your course, we're all a bit green, right?
I know I was. Some days I still am.
Well, it's sort of good, right? We're still learning.
Did you have any sort of role model in your life, whether that's family or outside of family, that was in a caregiving profession or even not even formally?
No, my mum's English, so they call it a nursery nurse, which is a bit like a kindergarten aide, I think.
Okay.
Like, she had wanted to do nursing, and she met my dad, who's Australian, and moved out here, so didn't take up nursing. So I guess she had that obviously that desire at some point to do caring, but she didn't become a nurse, and she didn't work in that role because I don't think the qualifications from England to Australia quite married up. So there wasn't anyone particular in that I had as a role model for that caring particular thing. Although when my mum was in hospital, she had some lovely, like really lovely nurses and doctors and stuff like that. So that definitely would have helped, I think, that concept. Well, it helps in that concept of feeling like healthcare is helpful.
All right. And then I don't want to beat around the bush too much. I want to go ahead and address it if that's all right with you. I think you are two things. You're my first Australian guest, and you're also the first guest I've had that, to my memory or knowledge, has a background in acupuncture as well. We can tackle either one of those, or we can do it concurrently if you want to. Is there anything maybe that I'm not aware of that maybe you should give me a little bit more of a lay of the land, either with in terms of how massage works in Australia or what similarities of acupuncture and massage? And yeah, I guess we can start there with that.
Yeah, I suppose there are less similarities than I thought there were going to be. Uh, when I started doing them together, which is naive now I think about it. Massage has obviously underpinnings that are more Western based, more physiological based around blood flow and the way muscle tissue works and responds and things like fascia, whereas Chinese medicine has obviously a very Eastern underpinning, but a very different, like it's a whole body concept. It's not, you can tear a calf muscle in massage and it's a local acute injury. In Chinese medicine, it's not, it is local and acute. You're still torn your calf. So it's still local and acute from that point of view. But the way that you understand it is whole body approached. So, did you have, poor spleen chi, which meant that you were likely to tear a calf. Even if you didn't, it's viewed in terms of blood stasis and chi deficiency and all of those sorts of things. So every bit about acupuncture is within that concept of very basically of yin and yang, and then there's multiple different other levels that the Chinese view that on, like the Chinese medicine views that on. And so it's a very different philosophy and mindset as to what's going on and what you would even do. Because obviously, if you're looking at chi stagnation and potentially spleen deficiency with a calf, that's you treat differently to you would if you were a massage therapist looking at a calf strain or tear. So they don't align brilliantly in that sense of you can sort of really smoothly move from one to the other sort of effortlessly. I think that they're different. One is that whole body medicine concept, and the other one, massage, is more about part of an overall system, because I don't do internal organs. I don't do endocrine or immune system stuff. So whereas in acupuncture, you can do anything. I mean, I don't think you can do anything. I think acupuncture is good for some things and not so great for others. But technically, from a possibility point of view, acupuncture can treat anything.
Does that kind of make it harder to develop a treatment plan for acupuncture?
For
Okay.
me, yes. Yeah. Yep.
It sounds like maybe it could be overwhelming if there's so many possibilities.
Yeah. And it's like everything that I think this happens in massage, and I think it happens in other industries. When you're learning and you get taught about a presentation and you get taught like how, frozen shoulder might show up, stone make people really red.
Scraping. It looks very
Scraping.
intense work.
Yeah, I feel like and dry needling, which is there's always a bit of debate for acupuncturists about the concept of dry needling, and because they're different, again, they're different philosophies. Like I don't have a problem. I think the skill of acupuncture is not teaching you how to needle, which is not that hard. It's teaching you where to needle and why. That's the hard bit. So dry needling, and I think this is that thing. If you're inserting a needle, you need to know why you're doing it and have a good understanding of what you're aiming to do and what you're planning to do. And dry needling is aiming for more of a Western, more of that Western style response. You're trying to either, change tendon tightness, or you're trying to get a pain, diminish your pain response. I think dry needling can be super effective when people are trained, like anything, when people are trained well. But just inserting a needle is just inserting a needle.
Okay. Can we talk a little bit about the word remedial? Because it's not a word that we hear much outside of Australia. Maybe could you give us either like if there's a legal definition of it in Australia or a clinical definition of it or your understanding of the word remedial?
I mean, it has changed a bit over the years, I think. In Australia, the course when I did it was two separate. It was a certificate of massage, which was the first year, and then you could go on and do a second year, which was the remedial aspect.
Oh, okay.
There were slight variations on what people called that, but essentially the first year is more of that teaching the techniques, but not really teaching so much like you're not really going to be technically treating injuries, or there's a limit of what you would be doing and why you would be doing those strokes. So it's more of, it's not quite spa, because in Australia, they tend to go through beauty schools to do the spa type treatments.
Wow, really?
Yeah.
Okay.
Yeah. So it's more that just relaxation massage. So the feeling nice, not too deep pressure, limitations with scope of practice because you don't have the skill to investigate, potential other things. You wouldn't be treating frozen shoulder. You would just be, I guess, massaging over the area with that certificate. The second year was that remedial aspect where you learnt about differential diagnosis. You learnt about those things that could present. You learnt about muscle testing or joint testing. So empty can test, those type of things that you might do to work out how to isolate someone's pain or work out what's going on, have a bit of an idea if it was, things like chronic, more acute, subacute, to do that. So that's, I guess, the difference here. They have changed that though now. You have to just do the whole 2 years. So they've sort of got rid of I think they've got rid of the certificate. It's all very confusing. And there were private colleges that offered it. So some of them would offer sports massage. So sports massage is a bit like, it sort of falls into both, because you didn't necessarily do the muscle testing. You just sort of learnt how to do like a pre-game, post-game massage. You didn't necessarily do the empty can test or injury assessment. So it is all a bit weird. And then we got national sort of standards that happened. I don't know when, sometimes in the early 2010s, I think, but I could be wrong about that. So at some point we got national standards, and so that has changed a little bit so that everyone is technically supposed to get a more similar education, not these sort of random sports massage or, weird things that sit somewhere. Although technically here you can do a 2-hour course and call yourself a massage therapist, because the title's not protected.
Oh,
You probably won't get insurance, but the title itself is not protected.
how
You could
interesting.
do you could do an 2-hour online course and then open up in a room in your house. You just probably wouldn't get insurance.
Gotcha. Do you care to opine on that, any, Sarah?
Well, I have very different opinions about that. Nothing. I think there's a level that with which you want to protect the public, so that there is some similarity in terms of standard, so that if somebody goes to see a massage therapist, they know what they're going to get and they know sort of what level they're going to get, not this very big broad difference between therapists. But I also know that not everyone can afford care, and if care is being offered within the scope of practice of your 2 hours, and you're treating friends and it's helping them, or you're charging $10 or, some small amount of money and it's helping them, and you are able to stay within your scope, you were very aware of your scope of practice, then I also I feel like there has to be avenues for people that have less access to care to be able to get some sort of care. And if we can't fix that systemically through our health system, then if it helps somebody get through the week and they're not being exploited, well, then we probably need some of them. Not that ideally it would be nice to have everybody educated, but it's also cost.
Yeah.
We're back to that socioeconomic, not everyone can afford to get qualified.
What a thoughtful and compassionate answer. Because most people, myself included, I'll be vulnerable. You hear that and you might get up in arms about it, especially if there's no title protection too. That irritates. I think I would be safe to say the majority of us.
And it is irritating on a level, but it also, I think, one of the joys about massage not being for in Australia of not the title not being protected is that we have more freedom. And so, because I am an acupuncturist, I'm just going to caveat, and my title is protected. And so, with that comes a whole heap of rules, most of which are great, and there's no like most of which are intended to protect the public, and so that's great, but sometimes when we work within systems, we can lose part of ourselves as an industry. And so I think we just have to be careful always as an industry that we know what we know what we're getting into when we say we're going to be regulated. So massage in Australia, the predominant, it's part-time, I think it's like 70% part-time and predominantly females. So they're not people who are making a lot of money. So in Australia, for me to be registered as an acupuncturist, just to hold that title, is $500 a year.
Mm.
And that doesn't cover my insurance, and it doesn't cover any other association membership where the association will advocate for the industry and help me personally. So I have to keep paying all of those things, and I have to pay $550, something like that, dollars a year just to be able to be registered to have so I can call myself an acupuncturist. Our industry is made up of part-time people. I like the idea in part of being registered, but are we going to lose some good therapists who it's going to become cost prohibitive to keep doing that? And then with that, there's some stuff around CPE that we have to do some stuff face-to-face or live. So there's elements of you have to do X amount of acupuncture CPD and parts that have to be either live or face-to-face. Which makes sense, but it's those sorts of things start to come, I think, with when you're within a system, there starts to be rules and regulations around it. And it's fine if it's going to work generally. We just need to be careful as an industry, I think, before we jump into anything too much and go, yes, let's do this, and then not think about those rules and regulations and are they going to work for the whole of our industry.
For sure. Yeah, we face similar problems here, even with regulations. So yeah, definitely worth pausing, giving some serious thought to, and collective, listening and hearing from all sides of people who are in the practice right now. You did mention something, a term that I haven't heard before. So if you don't mind, Sarah, could you give me a little bit more of an understanding about CPE?
Oh, so continuing practice education.
Okay.
So yeah, so it's similar to CPD, which sometimes people use as the things that you have to do to keep your registration. So acupuncture is 20 hours
Okay.
a year.
Gotcha. All right. And that's not
There
mandated
is
massage.
if you're a part of an association that you have to do a certain amount. It's just slightly less restricted it doesn't have quite the same number of like live versus, watching a recording or taking something online at your own pace. There's not those limitations.
Gotcha. Okay. I'm trying to maybe connect some dots, at least in my understanding that I've had previously. And maybe the closest thing I can come to is unregulated provinces in Canada. And my understanding is sometimes the professional associations can kind of fill the roles in the absence of regulators. Is that a similar case where you're at?
Yes. Yeah. And that is the argument for why it's not. So in Australia, the provision or the protection of title is based on risk.
Yeah.
so risk to the patient. So the industry is expected to self-regulate,
Sure.
mostly similar to that through an association who provides that regulation. Although the catch is, of course, that you don't have to be a part of an association. So, so, um, but that would happen with any. I mean, that sort of happens in some ways anyway, right? So, if you don't join, you're not bound by the rules and the regulations with which of the organization that you're with. So, if you want to avoid it, don't join.
Right. Are there multiple organizations that represent massage in Australia, Sarah?
Yeah,
Okay.
there are. Yep, there are.
Are they seen as competitors? Are there, pros and cons between each one?
A bit of both. A bit of both. I think associations are made up of therapists generally, and so most of them will have a board, which is a volunteer, volunteers, and they'll have a version of a CEO or someone who's steering the ship from running it, and they will bring all of those people will bring their own personal sort of strengths and beliefs about the industry. And obviously, you don't volunteer for those things if you don't feel strongly about things. And so over time, there are similarities between the industries, but there are also small differences where one group might want a particular, might have a particular stance on something, and then another group will, have a slightly different stances. I think for the big things, they generally, come together. It's probably those smaller things that maybe is where their differences are. But for any of them, and I'm sure it's the same everywhere, right? If it's got a board and it needs volunteers, it's only ever as strong as the people who are willing to volunteer time and expertise and all of those things.
For sure. It can kind of be a double-edged sword sometimes.
Yeah.
I want to go ahead and be mindful that I'm putting a lot on your shoulders as my first entry point to an understanding of Australia and massage. Could you tell me a little bit, at least from your experience, is there much public knowledge of the differences between these, what I'm going to call levels or tiers of massage, and that there isn't title protection? And then is there much cultural hesitancy to working with massage therapists?
There is, I think over time, there has been more understanding of massage. More, I guess, I would say from the difference between those that offer sexual services and those that don't. There's probably been a widening of that gap a little bit. There is a clear, I guess, more delineation between that spa type, treatment, which is more of an indulgence and, you know, more in sort of like a wellness center and type of thing versus massage for symptom relief. So it's probably clearer there. It's probably not so clear and a bit wishy-washy in the middle. For me, I think sometimes I find it in clinical practice, there's a bit of a desire so people come to you wanting something. So they have tight neck and shoulders, they are sore, they want something, but they almost want a little bit of that relaxation thing as well. So sometimes they do that thing where they go, I want my back, neck, and shoulders done, but could you also, do my legs? And and sometimes I find that difficult to work out where they're sitting. Like what exactly did they think their massage was going to look like? Because if you're too clinical, then they walk away going, that wasn't quite what I wanted. But if you're not clinical enough, and how do you marry that up and then have that conversation where you say, hey, I'm not going to be able to do what you want to help your neck and shoulders and give the rest of your body like a relax, more of a relaxing treatment. So I think there's a little bit, I think there's still that sort of area where there's some grayness. I think there's also um, a level where the role of massage fits, I guess, in health. So within cancer care, massage therapists are more embedded in that space. They do work, as I said, in football clubs, and they do work along in sports medicine centres. I don't think everyone shares always entirely the same thoughts. I don't think other practitioners and other healthcare providers always share the same value of massage and what it can do. And I think part of the problem that massage has is that within its group of therapists, there are a broad range of therapists. So we're back to that. Therapists that just do more spa and beauty treatments, those that do just more relaxation, sort of light, light to medium work, but don't really work specifically on anything. And then those that are more, in this case, remedial. And so it's a really broad thing. And we don't really have that in other bits of healthcare. Like you're not a doctor that like there's no version of doctor that just does a spa treatment, like a spa treatment version. So I think that's where some of that can lie within within Australia. Some health professionals are great with it. They think it's really good. Other people, think it's just more of that luxury sort of thing. And I think we're still working on that. And I think that part of that comes from we're not as evidence-based in that sense that we're young in terms of that evidence base being produced. So it's hard to sometimes have those conversations about this is what massage does because we know what it does, or this is where it can be helpful when there isn't that research, which is, often is what other healthcare providers want. And I think they mostly are trying to protect their clients and patients from being charged ridiculous amounts of money for things that might not give them an outcome that they want. So, and some of them just don't like it. Or they've had bad experiences with very, and there's out there practitioners in every field, right?
For sure.
If we encounter one of those, our impression of that industry, if that's our first one, is never going to be great. So
yeah, first impressions. When you engage with practitioners internationally, is there anything that really sticks out to you, a difference between how either practice or theory with massage? Is there a difference between how it's done in Australia versus how it's done elsewhere in the world, or a difference in the practitioners maybe?
I mean, I think there is a difference because America and I'm assuming Canada, particularly with the way there are registered and unregistered, or whatever those terms are, that there are different levels within each different sort of either province or state that complicates things. So it's hard universally to go, yes, very different, because I think some of the states and provinces are very similar, and then in other areas, I think not. I think massage therapists, I think scope of practice is such an interesting discussion to have around massage, because I don't think as an industry we've really got on what it is that we like, where our scope boundary ends. So, we sort of, as an industry, I think we sometimes take things from other areas. So like with the acupressure sort of stuff, or dry needling or cupping, that's okay on some level, but it's also, and like exercise prescription, like how much exercise prescription do we do before we actually become personal trainers or exercise, like we're verging into the exercise physiology aspect. We offer some lifestyle advice often to people. Where is our scope about that? Like, when are we becoming dietitians, or when are we becoming nutritionists, or when we don't really have those discussions. And I think probably sometimes I notice more scope of difference practices sometimes between some of perhaps of the provinces, but that also isn't, there may be therapists here that are doing that I just haven't met. So I just think scope of practice is such an interesting concept. One of the big things that I probably think and have noticed is in the States, there's just a little bit more rigidity around mental health. So massage being used to support mental health. I think it's a little stricter than it is here. I, but I could be wrong. It could just be the people I've spoken to from America. But I feel like there's more of a, we don't treat mental health. But whereas here, it's slightly less rigid. We don't treat mental health. Like we don't do talk therapy. But again, we're back to boundaries, right? Listening, I think, is a super valuable tool that massage therapists do. We have a lot of time to do it if our clients feel like talking. And so I think listening can be a super helpful part of your treatment and part of that therapeutic relationship, as long as it obviously doesn't go into talk therapy. But I feel like it's a little bit more, from a couple of therapists I've spoken to in America, it's a little bit more like shut off a little bit. Like we don't do that.
Yeah, definitely. But yeah, I also think it can sometimes be hard. Those lines can definitely be blurred sometimes, and depending on which practitioner for sure that you're dealing with. But yeah, all right. Let me ask you as a follow-up to that, and maybe I can't make any promises. This will be my last Australian specific question, Sarah. Is there any sort of like indigenous cultural influences in massage that shows up in Australia?
Short answer, no. I feel so it's not to say there aren't Indigenous practices around touch and around massage. We definitely didn't learn any. I don't know of any courses that specifically talk about that. We don't, I mean, when I studied, we didn't do anything around, we did very little about cultural stuff in general. We did a little bit about not everyone loves eye contact and sort of stuff, but not much around um, different cultural practices around, dressing, undressing, whether, partners are in the room, about whether, so for our Indigenous people, whether you get massaged on country, all of those sorts of things. There's no specific thing around particular types of oils or, things that they might add to an oil to help enhance or do a massage. I sadly I'm not even sure about how they feel, the Indigenous people generally, whether they even had touch as a part of that, of their system and how it worked. It's not something that generally gets shared. And that part of that is, it's not uncommon in Australia for Indigenous groups to keep their particular things not secret, but a little closed. So, and I get, cultural appropriation is a big thing. So I don't have a problem with that, but it is in a really interesting area that I think is one of those really big learning things for massage therapists, particularly if you want to work within an Indigenous community. I think there's a huge amount of learning that you sort of almost have to do on the job because there's not much being taught about that. And it would be super interesting if there was. It'd be so interesting.
Okay. All right. Cool. Thank you for really giving me like a Australia 101. I always appreciate a little bit of orientation, Sarah, so thank you for that. Talk to me a little bit more about your entry level education. Did you have like a large cast of instructors? Was this more so one instructor that was running the entire program? And if you can, talk to me about like any specific textbooks or tools that were central to your learning.
So we had different instructors for different subjects, which was interesting. So massage specifically, we had an amazing physiotherapist that helped us do some of that sort of like, learning about the body and how things present. So sort of clinical stuff, the difference between osteoarthritis, rheumatoid arthritis, and how they present. So he was amazing. We had an exercise physiologist who was also amazing, doing a lot of our, I guess, differential diagnosis. So that was where I first learned. When I went to and did that second year elsewhere, we had one lecturer that did a lot of our subjects, and then specialists were brought in for specific subjects. But again, he was amazing. He was very knowledgeable and, was a great teacher. And I think because it's such a dysregulated industry in that sense that it's not a university level entry in Australia, it's a certificate course, and there were private colleges that were teaching. It was a bit hit and miss who your educators were and what sort of training they had to have to be educators. So I was very lucky. I had some really good educators, but I did also seek that out a little bit.
So you did some research maybe to try and figure out which programs you wanted to attend?
Not so much when I first started, clearly, because I didn't marry doing those two things together very well. But as I got into it more, we did have that amazing exercise physiologist doing differential diagnosis, but we didn't actually get taught any other hands-on technique in that second year. And I think it was just because they'd got him as an exercise physiologist as opposed to a massage therapist. And so that was part of the reason that I chose to move to finish, was because I actually wanted more hands-on stuff. And so I definitely got that. And I was more aware of that when I went to the second place. I very specifically went somewhere that had a more hands-on approach, and I've got to say both were really good, right? Like it was a great grounding in differential diagnosis to have an exercise physiologist teach you all of that sort of stuff. And he was great. But he wasn't great at teaching you massage. We didn't do a single hands-on thing in any of his classes. We just learnt the difference between tendinopathy and other things. Like it was not, different presentation. So I definitely sought that out more in that second one,
All
when
right.
I was a little bit more knowledgeable about what I might be looking for.
Well, and also I'm going to say good for you for, taking that initiative and, finding a program that, could give you a little bit more because yeah, you want some hands-on stuff whenever that touch is going to be central to the practice you'll be doing.
I did. I did.
I'm gonna ask again, like any specific textbooks? Because I'm getting a little bit more familiar with what our Canadian neighbors use, but I really have no baseline knowledge for Australia.
Um, there was an anatomy and physiology textbook. I can't, Tutora and Grabowski, I think maybe but anatomy textbooks are anatomy textbooks, right? I don't know that they differ that much, to be totally honest. I don't think there's random weird ones that go, oh, this is what the human body looks like. No, it looks like this. So it's a general
Gotcha.
anatomy and physiology textbook. We use Bruckner and Kahn's clinical sports medicine book, which is in, I don't know, I'm going to mess it up. Sorry to the authors. I think it might be in its fourth or fifth edition. We were early in its edition. It's evolved to be more evidence-based. For me, that means some of that massage stuff has probably come out of it a little bit more. It's got much bigger. It's now in 2 volumes as opposed to 1 volume. So that was probably our big textbook in terms of that sports medicine. It was a very sports medicine based when I did it oh God, I did it from 95, I think, to 2000. It was very sports heavy. Like they just assumed you were all going to come out as sports medicine. So whilst it was remedial, it was really geared towards you working with a sports team and with injuries and with people who had problems. We didn't do much about chronic pain. That has definitely improved heaps in the last 26 years. That there is now more pain education. They also understand pain better now. And I think the research coming out around that has made it easier for practitioners to bring that knowledge into their clinic. So there wasn't very little about pregnancy. There was very little about there was nothing on helping support people who, are having tight neck and shoulders from anxiety or from, grief or depression or any of those sorts of things. It was literally very sports based. Thus the textbook was clinical sports medicine.
That does bring up another And maybe we haven't really moved away from it. A specific Australian question for you, Sarah. In the absence of a regulator, do you know when, like maybe if you can look to the associations, when any sort of like formalization of massage came on the scene, so to say?
I mean, there has been formalization. So one of the associations is having its 60th anniversary this year. So there have been associations, but you can see it through the evolution of massage research in the sense that there just really wasn't any much before, well, there wasn't any research really, maybe 1920s or 30s, the first sort of little bit came out. But in terms of things like randomized control trials or all of those things, it's happened so much later. And so I think courses were so different. I think the courses have evolved to be more evidence-based, to match the science, the pain science. Doing it now would be so different to when I did it, and where massage's role is. And I think if we look at, that oncology massage, they have done a great job generally at collecting that evidence and then starting to embed themselves in that usual care and within hospital systems. But it's taken them years. Like, this isn't something that just happened quickly. It's taken a long, long time with some really amazing therapists and some really amazing healthcare providers that have really supported that version of wellness. And I think we are in an era of healthcare where wellness has taken on a much bigger role. Whereas in the 1970s, I don't think our healthcare providers were dealing so much with wellness. I mean, they were always dealing with wellness, right? But not so overtly. They were, trying to fix problems. They were, there were also limited options. Things like ultrasounds have got better, which means diagnostically things have got better. We've got better at managing certain conditions. Diabetes it's still a big thing, but it's not as dangerous as it used to be when our treatments were more rudimentary. We've got multiple different medications that we can use. We've got better things to detect. We've got systems that you can now embed. You don't have to test every so often. They just, stay in and just give you a reading when you need it, that indicate when if you're having a hypo or a hyper. So, I just think care in general over those years has got better. And I think massage has also sort of kept up with that. We're just a bit behind in our research, as in, because we're also prohibited by the fact that it's not a university course in most places, which means it's really hard to access postgraduate/academic resources to be able to participate and contribute to research. But it is, I think, if you look at the publications involving massage, they've definitely improved, and the breadth of that has improved, I think, too, covering all different things. So I think then what we teach is different to what it was, 26 years ago. Make me feel old.
No, 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 no. No, that is experience and wisdom.
Let's go
No.
with that.
And and there's also, thank goodness. I don't know, again, differences in culture, but longevity in the profession, I think that's really something to be proud of. Kudos to you, because I really admire people. I'm 12 and a half years myself into massage, but I still admire people who've been doing it.
I think it's also an area that probably isn't covered in that we didn't learn anything about self-care. We didn't learn anything about compassion fatigue. We didn't learn about burnout. We didn't learn about moral distress, where we might have to, experience it. We're in this weird space which is amazing, right? Because we do hands-on and we can listen, which is such, I think, an amazing combination together. But we don't have a mentoring system per se. If you're in talk therapy, you normally have some sort of mentor or someone that you debrief with. We don't generally work in formalized hospital systems where there might be someone that you can talk to within the hospital if you need to debrief something. Like if someone dumps something really big on your lap, we don't learn about vicarious trauma so much. I mean, that changes a little bit. We don't talk about those things. And if we do, it's brief and it's not really solution focused, as in You might get it. Like, great, awesome. What do I do with it? Now I've got it.
Yeah.
Like,
For-
because there's not ready options. We don't work often within systems that have, in Australia, we don't have, most people are self-employed or, as I said, work part-time. They don't work for most of them don't work for big organizations where there's an employee assistance program where they might be able to access some counseling or something. So it's all, again, we're back to that, conundrum of they're not getting a lot of money because they're only working part-time. And then they have to try and cover the cost of their business, and then potentially, if they need to debrief, they have to be able to get in to get, see a therapist or something. And yeah, we don't often people work alone, they don't work with other massage therapists, so you can't necessarily debrief with a colleague. I think that's an area that we probably haven't improved on amazingly. And I think that contributes to the lack of longevity in our industry. We get we get to be really close to people and hear lots of different things and do that. We're informal counselors in a lot of ways.
Do you have any sense of if that has improved with like preparing entry level for things that might come up like that in their education?
I don't feel like it has brilliantly, and I think because there is, even if they talk about it, it's a bit like what I said before. It's a bit like saying to someone, you need to look after yourself. Great, awesome. Don't we all? Um, but nobody can be resilient without resources. And so if we're actually not helping to resource someone, then saying you need to take care of yourself is actually just empty, right? Like and often may make people feel worse, like they feel like they're not doing a good job of trying to manage their very stressful lives. And so I feel like it's a bit like that. We might talk about it and say you might get burnt out, you need to be careful, vicarious trauma, don't give too much of yourself. But I haven't been through that system for a long time, so maybe it is better, but I don't actually feel like there is that next step to resource people, to give them options that mean that they can actually better self-care, and maybe they're just more mindful it can happen, which is useful, but not so useful if that still leaves to people leaving because they don't feel like they have an option to seek support or care and stay in the industry.
Thank you for going down that rabbit hole a bit with me, Sarah. Let's talk about when you completed your entry level program. What was the first step for you? Was that the work with the Hawthorne team?
So Melbourne, I originally started at Melbourne Football Club. I worked at Olympic Park Sports Medicine Centre, which is a big sports medicine centre that deals with a lot of athletes. And from that, I got some work with the Melbourne Football Club. So very sports based, hugely, really good, I guess, learning space. And that's the exception to what I've just talked about. There were multiple therapists. And so even though you're in separate rooms, you did get close to them and you did talk to them and you did sort of, you did get a little bit of that learning bit together, which was great. And then the football club was an amazing learning thing because for us, we were all in the same room, so you could see other therapists doing stuff. And so you could be like, oh, what are you doing there? Why, how are you? So then you could ask and say, hey, how do you treat that? Like, why are you treating it like that? And then get someone to show you. When I worked at Hawthorn Football Club, the physios were great. The way that building was set up, the physios were right next to the massage therapists. And so there was quite a lot of interaction between the physios and the massage therapists, and sometimes the physios would show us some stuff that they do to treat certain things. So that was a really big learning thing. For me, you got to see things that you wouldn't normally see because they don't happen generally unless you're in, a high level athlete. But you also got some of that collegiate bit. You got to see other people. You didn't get stuck in that routine, even though I mean, I don't have a set routine where I do the same thing every time, but I think you tend to pick the same techniques and massage similarly. So it was really nice to go, oh, someone else is doing that. That's really cool. So it just gave you that visual of potentially going, oh, I could treat something like this. You got to work with other people. You felt like part of a team. And that was nice. That was actually really nice.
Can't help it. Again, cultural. It's
Mhm.
maybe we just won't escape it, Sarah. When you say football,
Yeah, I knew that was going to come.
are we talking
I
soccer?
have No, we're not talking soccer. We're talking about the weird sport that only Australians play, which is Australian rules football. So the one where you kick the weird shaped ball and you handball, and it's only played in Australia. We call it football. We call soccer, which is football everywhere, football everywhere else. So yeah, no, it's Australian rules football, weird sport. That yeah, I don't quite know. I don't quite know why, how it came evolved and how it happened. But yeah, we're a country that plays Australian rules football, which is a weird, I don't even know how to describe it. It's because you can handball, right? So it's not football. You can like literally handball as well as kicking it. So yeah, I don't know why it's called football. It's not all with the foot. You can bounce it. You can bounce the ball and run with it. I don't know. It's a weird sport. So no, not soccer for everyone who's listening. Not soccer. Not NFL football. So not NFL football. But yeah, some weird sport that you'll just have to look up on social media or Google.
I definitely will be. Because so it's not soccer and it's not American football. It's totally
No.
different. Okay. All right. Well, you've given me homework.
And you're probably going to go, oh my gosh, what is that? Doesn't make any sense.
Well, there are probably things that you see here in the States that you're like, what on earth?
The Society of Massage Archives invites you to join us for a virtual book club and discussion circle, a monthly 90-minute virtual deep dive into Dr. Patricia Benjamin's book, The Emergence of the Massage Therapy Profession in North America, A History in Archetypes. This isn't your typical book club. It's a conversation where we'll read the emergence chapter by chapter, reflect on the stories, struggles, and triumphs that shaped our profession, and explore how the past informs our current and future circumstances. Discussion circles are moderated by SOMA's Executive Board of Directors, with special guest hosts and Q&A sessions with the author, Dr. Benjamin. Registrants will receive access to the ebook format courtesy of Sutherland Chan School of Massage in Toronto, Ontario, Canada. Virtual meetings will be held on the second Monday of each month at 6:30 p.m. Eastern, 5:30 p.m. Central, 4:30 p.m. Mountain, and 3:30 p.m. Pacific. Visit our social media on Facebook and Instagram, or our website at societyofmassagearchives.org to learn more and get registered today. We'll see you soon.
Another follow-up to that is the first couple of jobs that you have as a massage therapist are really sports and athletic focused. Is that something that you wanted to do, or is it more so a product of the program that you attended, just that was kind of the expected route for you to follow?
A bit of both, I think. At that time, as I said, it was that was a textbook, clinical sports medicine. That's what massage really was, I guess. People were using it for. And, again, I guess a bit like that oncology thing, there was a little bit of that synergy between, it was at a time that the football clubs were going more professional. Until that point, people got paid but had other jobs. So football itself was getting more professional, and like a full-time job as opposed to something you did on Tuesdays and Thursday nights, and then on Saturday you went and played. And so with that professionalization, there was more inclusion of doctors and physios and massage therapists. And so I suppose it was a byproduct of just the time that massage was starting to integrate more into that care of an athlete, and probably because it is so synergistic to do that, right? Like, it's where people get a lot of benefit. It's where things like, athletic performance can improve, and that's what people want. So it's probably an area that was really open to that. It was an area, again, as I said it when I was going through, it was very sports sort of oriented. If you didn't want to work in a clinic that saw sports, that had injuries and stuff, then I don't know that our course set you up as well for that, because I think there was just the presumption that everyone was going to do some sports sort of massage. And it was where the job opportunities were as well, which is, part of that came through the connections that I had with people at the course that I did. And so there was that. So it sort of just literally all fell together in terms of just the right timing. It's where there were job opportunities. It's sort of where massage was at that point, was much more sports sort of focused. And I guess that into that mainstream, that's where it was more mainstream. It was much more common for people to go, right, we're playing sport, we're going to get treated. So yeah, it just fell nicely.
I suppose that actually makes a lot of sense, especially with remedial massage, right?
Mm.
Sports, you're more than likely to get injured. You see a remedial massage therapist. Yes.
Yeah. I mean, there's also that avenue that we didn't talk about much, but a little bit, the repetitive strain stuff, the work injury stuff, the, posture related stuff. That we did a bit of that. And that definitely was that becomes part of your load. Even within the sports medicine center, that was part of your load, was that people who had, RSI, repetitive strain injuries and stuff from working on a computer, using
Yeah.
a mouse, so many wrist things. But it was definitely that idea that you were specific. I guess it was that separation. You were definitely seeing someone remedial for that sort of stuff rather than just going and getting a nice sort of relaxing, non-spa, but relaxing sort of massage that you just walked out going, oh, I feel better.
That also brings up another question that I had but forgot. Earlier, I believe you mentioned insurance. When you have someone that comes into you for a remedial massage and injury, and maybe they also want a little flavor of that wellness, relaxation, does insurance make that challenging as well?
Yeah. Yes, a little bit. So technically, if you aren't remedially qualified, people can't claim through their health insurance, their private health insurance. There's no public, in any way, you can't claim publicly for anything. It's people have to have take out private health insurance to have massage included. The private health insurance companies put certain criteria on claiming, and that has changed over the years around, it has to be a designated like clinic setting. You can't be claiming, like I can't set up a table in my living room, and it has to be a clinic-based setting. So people can, it is a grey area in terms of wellness, and technically you need a clinical reason, but often, so if it's very clearly just wellness, as in there's nothing really wrong with me, it's my birthday, or I had the day off and I wanted to get a massage, that technically is a no claimable through insurance. But if you are like, I'm stressed, I'm a bit anxious, my neck and shoulders are tight, well, then that is part of that clinical reasoning that you can, if you word it the right way, you can potentially
Got
get it through. So there has to be something, again, that's that clinical reasoning, right? That this person is presenting with restricted ranging, a small restricted range in movement, and tightness with movement, and then write that stuff down. You just don't write a bit sore. So they're a bit sore, want massage. So there has to be that, that note of, what area is tight, what area is sore, what the problem is. And you wouldn't necessarily, I mean, if it was just purely the mixed one, you can sort of get away with a bit because you're doing the majority of the stuff on the larger parts of that treatment, and then a little bit at the end. But it would be, if it was all of the wellness stuff, you'd technically not be able to put that through insurance.
Gotcha. That brings up another interesting question. Maybe let me ask you this. What about where would maybe like maintenance or preventative?
Oh, good question. Oh, it's such a good question. I think that's a really grey area. I think you have to tease out the clinical aspects of what is it that is giving that person that time frame, right? So I don't disagree with maintenance. I think it's really important to check in every so often and make sure that everyone's on the same page, that the goals are being met, that the person's still getting what they need and it's still appropriate. But I think maintenance is a big part of it. I think it's around making sure that when they come in, you are actually doing that individualized care, that you are actually saying, tell me about what's happening with your body today. Tell me about where you might be feeling some tightness and pain today. And it doesn't have to be the same level that it was. That's partly of what maintenance is in terms of that point of view. So I think for most people, when they do maintenance, the reason they're doing maintenance is because there is either something in their life that they can't change. They work at a computer, they do long hours, they get sore. So they're going to come with something. Like that, it's not, the maintenance is not, I have nothing and I'm going to keep coming back. For most people, for me, maintenance is around, there is something in their life, whether it's a stress, whether it's anxiety, whether someone's ill and they're caring for their parents and it's showing up physically for them in their muscles and tightness. Massage is helping them manage that in terms of, it's not really maintenance for me, it's helping them manage something that's happening in their life to a point where it doesn't just go woof and then they end up with whatever migraines or really unwell. I think maintenance, as in again, we're back to that. If you're just getting it, there's nothing really showing up and you're just getting it because it feels nice once a month. Awesome. If you can do that, great. I don't think that would fall under the health insurance thing, though, because there's nothing really presenting. There's no clinical features to that. But for most people, maintenance is about a clinical feature that returns or needs to be managed for a time period, or because most people can't give up their job, right? You can't say to someone, well, don't work in front of a computer all day. Sure, that's great advice. How am I going to get paid?
Yeah.
I've swapped one stress for a different stress. I think maintenance is more about management.
Okay.
Manage something as opposed to specifically just come at a set time frame because it feels nice. And go for it if that's what you want to do. Great.
Got it. Thank you for that. I agree. But like actually hearing like you work through and giving a thoughtful response was actually really helpful for me, Sarah. Thank you. What about, I don't want to muddy the timeline too bit, but if we have to, that's okay. What about in terms of your master's acupuncture, right? And I guess, are you still working with these like athletes, sports teams? What about your own business, Sarah? Lay some of that out for me in terms of like a timeline, maybe.
So I don't work with athletes in the same way. So I worked with athletes and the AFL football club for 10, 11 years. And then I'm going to caveat, I'm a lifelong learner. I am someone that keeps wanting to learn. And my master's gave me an opportunity, and this is the thing that acupuncture has been super helpful in because it's a university course. So it gave me the opportunity to do a master's, to get involved in that sort of research type world, and then to do a PhD. And when I finished my PhD, I got an opportunity to move states and try and continue some of that research work in a different state, which is when I finished up with the football club, because I moved states. I then got interested in women's health, and there's a really great course that I did around pregnancy massage that, again, I suppose met that level of really teaching you to think, I guess, not just going, right, we do one stroke up the back and then we do another one around here, and then that's how you do a pregnancy massage. And so for me, all of my learning is about that. I don't like rote protocols of you do two strokes up here and then you move over here and then you do a bit of petrissage there and then you do some of this and then you do that. It's like, for me, that individualized, and working at a football club is that, right? It's individualized care. The patient comes, the athlete goes, I've had this happen. This is where I'm sore. This is where I want treatment. It's not, at no point were any of us doing the same up the back. People, I've massaged a sternum because someone hurt it in a game. So I guess that I was lucky enough to find that in women's health when I was looking for, I guess, a little bit more of that learning, and to have those skills, I guess, expand into an area I was less familiar with. And so I got involved more in women's health. And then again, those life opportunities, right? I don't know how that works in terms of, that's a different question and probably a different podcast, on, when doors open and all of those sorts of things. But I moved back to the state that I was originally from, and I got some work working in a women's health clinic. And so then, of course, I was seeing the clients for which I'd done the study for. So I could then start to apply that learning. And that's really what happened, as we've talked about with the sports stuff. I got that opportunity to work. We learned a lot about sports in my primary course, and then I got the opportunity to learn about it and work with people all the time, like a lot of the time in that space. And then the same sort of thing happened with when I was doing the pregnancy and women's health stuff, is I got an opportunity to work in a women's health clinic, which is certainly helpful because you get to do it all the time. Like, it becomes so much more relevant. The stuff you learned becomes so much more relevant, and you get to learn more with different presentations and the way people come in. I think it must be super hard if you do like a pregnancy massage course and then it's 6 months before you see a pregnant woman, because you've probably forgotten it all. So I was really lucky to do that. And then I guess for me, that then was that chapter again of new learning, of new trying to, it was different. Pregnant women, they're not the same. It's like athletes, right? They're not the same. Sometimes I think if you work in an area where there's a lot of neck and shoulders, like, people go, I'm sore, I'm tight, I'm neck and shoulders, it's from work stuff. You can get a little despondent because it's like, oh my God, another neck and shoulder. Like, pregnancy's that thing. People will have sore wrists, they will have sore ribs. I probably have treated more ribs in a women's health setting than I've ever done in my life. So it's that opportunity to learn and then put what you know into practice and help people and interact with them. And I think I've always been a big believer in the therapeutic relationship, and that what we do is massage therapy, that we are involved in what we do, that it's hard to separate, and we are part of the consultation. And even when it's just doing the calf that might have been strained, we're still who we are, still makes a difference into that aspect of care. And so with women's health, I think that becomes, again, more of a big thing. People need to feel safe. They need to feel that you know what you're doing. Nobody wants to go and see someone with their unborn child if they don't feel like it's safe. And so I feel like that marriage, and then also that point of wellness starts to come back again, like mental health, anxiety, stress. People get stressed in pregnancy. I mean, people got stressed in athletics, but it was less spoken about. And the difference being that both of the places I worked at had that as a separate. So the football club had a psychologist on board, and the sports medicine centre also had psychologists. So there was cross referral, but we weren't so involved. Whereas I think you're not going to send necessarily, and you always refer someone out if they need it. But if someone's just a little anxious in pregnancy, you can sometimes just helping them with their nervous system can make them feel like they've got more space to cope and to manage. And then you can just gently signpost some options if they start to feel like they can't manage. Or if they get super anxious, or you just remind them that they can go and speak to the healthcare provider and talk to them. So I think it started to marry a lot of those things that I think are really important in what we do as an industry. And what we do is from massage. The therapists I think the therapists are a big part of it.
All right. Did you ever think like women's health would be a particular big draw for your career at any point, Sarah?
No. No. As I said, I can't remember doing very much about pregnancy massage in my original training. It was not. I think for me, part of it is I like the science, I like the research, I like all that sort of stuff. And I think probably when I started, there was hardly any. I mean, Tiffany Field and her amazing group of people at the Touch Institute were starting to put out some amazing massage research, but it was very early days. And I think what my course really did, particularly with the exercise physiologist and the people that I talked to, was really set that idea of you need to know what you're doing and why you're doing it, and then add that to my bit that I need to be curious. Like, if I need to know why something is going to work, and I need to know that things are possible. So I've written as you may not known, I have quite strong opinions about fertility massage because I think we owe it to the people that we see not to, particularly when they're vulnerable, that not to overstate what we do. And I don't know that we can say that massage makes someone more fertile, which is ultimately what fertility massage is, right? Somebody wants to be pregnant. I absolutely think massage has a space to help support someone through a really stressful time of infertility. I don't think we know anything about dosing in terms of massage to know when, in terms of purely working on fertility, improved conception. We don't know when to dose that. We don't know what sort of dose. We don't know where to massage. But what we do know is that it is super stressful and that we absolutely can help someone manage that. We can help with their nervous system. But I don't think that's a specific type of massage. I think that's just massage. I think that's just what we do in general with massage. I don't think we need to call that fertility massage. I think it's just massage. And what I'm going to do for that person is help support them in that space. It's not a specific special thing. I'm sure others will disagree. I'm so sorry if I've started it. I'm so sorry if I've started something horrible. So I've always been curious because I think those are the questions we should be asking if we're selling. If we're selling massage to help with fertility, then it needs to help fertility. And we need, as massage therapists, to go, how? Like what are we doing? Are we changing the endocrine system? What are we changing that might help this person? Because we need to know, I think we need to know that. Your client needs to know that. You need to be able to explain to someone why something might be working. And so women's health women's health wasn't even that big in general, right? Women, I don't know if it's the same overseas, but women's health has become bigger in the last probably 5 years of treatment, more specific for women. There are more general practitioners that are going into women's health. There are more physios in Australia that are focusing on women's health. So I feel, I mean, that's in the last 5 years, but I feel like that we're getting better at women's health, and that part of science interests me, I guess, that what can massage do in this space? Like how do we support? What do we do? How is it working? And you sort of need some idea of that, I think, for me. And look, obviously obstetrics and gynecology and women's health in general have a lot of those things around that research around what happens when a woman's body changes, when they get their period, when they start to go into perimenopause. We have a bit of that data, which I think becomes that foundation for how then we can explore in massage. I probably haven't gone into some other stuff because I don't think there's that foundation in other areas for even massage to wander.
I appreciate you opening potentially a can of worms because it was a question that I had when I came across the materials you provided me for this fertility massage. I haven't heard too much about it. Might just be, where I'm at, or
Australian.
maybe I don't have a pulse on it. It's a big thing in Australia, though.
No, it's not a big thing. It's just there are a few therapists that offer fertility massage. There are a few therapists in Australia that offer, the wording has changed probably in the last little bit, but there's still occasionally some therapists in Australia that offer labor induction massage,
Hmm.
which I also have a problem with because we don't induce. We don't. Again, we can support, I think labor support is fine, but again, I also think it has to be individualized. We can't be just doing some acupressure points to support. And this is probably where my acupuncture does actually become much more useful, is that we can't just push on a bunch of points. And also, there's no evidence that pushing on a bunch of points actually improves labor outcomes at all. There's a systematic review that says maybe acupuncture might, but that same review says that acupressure does not seem to make any difference.
How interesting.
So I am all for support. Like if women feel like that's going to help them prepare, if it's going to help them nest, if it's going to help them feel like psychologically feel like they've done all that they absolutely can, if they're worried about an induction, like being induced, having an intervention if they feel like they've done everything that they could personally. Maybe mentally they'll be better off. Like, I'm all great for all of that sort of stuff, but we are supporting. We are not inducing. We're not inducing. I mean, as an acupuncturist, I'm not even inducing. If it worked well, we wouldn't need medication and balloons and things like that to induce. We could just press a few points and we'd be good.
Gotcha. All right. Yeah. Thank you for going deeper with that for me, Sarah. Another thing that maybe I had a question about in your materials, bereavement massage.
Mhm. Yeah. Again, it's not a specific, I don't do protocols for me. It's I guess it's that idea of using massage as a tool that some people might find helpful as they're going through their grief journey. Everyone's going to experience grief differently. Some people experience grief very much in an embodied sense. So tight neck and shoulders, difficulty breathing, all of those sorts of things. And I think that acupuncture, again, within scope of practice, right? We're not going to make it okay. Bereavement is bereavement. It sucks. But we can support the body in that moment to be able to, particularly if they've been in fight and flight and their nervous system is really elevated because of particularly recent bereavement, but even not recent, it might be coming up to an anniversary or, one of those things where that nervous system starts to, become elevated, that massage is a tool that people could use, because we do know that massage can help with that down regulation of the nervous system and help put someone into rest and restore, even for a moment, and that the bodies generally, particularly if they've been in fight and flight, really appreciate that moment of rest and restore. And I think this is where that talk thing can become really powerful. So for anything where things are, I guess, disenfranchised, where we don't talk about them much, having a space that your grief is not questioned, that you're not being told, oh, you're not over it yet. Oh, have you gone through the 5 stages of grief yet? Which one are you in? That a little bit of understanding and a little bit of creating that safe space for someone to have a few tears and to not need to fix it, and just go, what do you need today? And how can I help? Is lovely. And that could be other things, right? They could get that from going out on a walk in nature and their nervous system could downregulate. They could get that from going and getting a spa treatment. Like, there are multiple ways, but I think that the element of it is that if you're going to do it with massage, then you need to make sure that you are able to be safe with them and you are providing that safe space. So I think it's the same when you work with any group that is perhaps perceived as more of a minority. If you see a refugee, you're probably not going to go, why is it taking you so long to get here? Like, you've had this for ages. Why haven't you done anything? And it's, to understand those circumstances, to understand that people may not know where to go. They may not know who to trust. They may have come from a place where the health system was not to be trusted. They may feel really vulnerable. They may feel like there are language barriers. There's a whole heap of reasons, right, that can happen. And I think I'm interested in bereavement because I think it's universal. Most people will experience it. How we experience is not though. It's unique. I think massage has something to offer, and I think it's a space that would be amazing, in a bit like and I guess it's a part of that mental health thing. I think it would be amazing in 10, 15 years to see massage more in part of that wellness aspect. I think bereavement fits already because it's part of that oncology thing often, unfortunately. It's already in that space a little bit. And I think massage often has things to offer, not that there is not no hope, but I think it has things to offer when there are limited treatment outcomes. So it's one of those tools. It's, there's limited options when people have got cancer and they're terminal. Wellness takes on a different thing. It's medicine itself. It becomes a tool to help people. It's not fixing anything at that point. And I think if the similarities for bereavement are really strong, we're not fixing it. but you have to be able to work in that space where you can feel like you don't need to fix something, which can be really hard for massage therapists. But again, I think you can work in a low socioeconomic area and offer, cheaper massages and do exactly the same thing. It's just not called, it's not bereavement massage, right? It's less, you're not giving it a name so much. I think you can work with, homeless people, veterans, domestic violence, survivors, and have huge impacts for those same reasons. We're just not called, like, it's bereavement just has a nice name to it that you can call it a bereavement massage. We're not calling it domestic violence. I don't even know how you'd start to put that in a name. Domestic violence survivor massage? I don't know. Yeah, I think massage has some really amazing spaces that it can go into for those areas where people are vulnerable, and where I think that the aspect of feeling safe, helping people feel safe, doing individualized care, and using those traits of, kindness and listening and having someone feel heard and not judged is I think there's some amazing scope for massage in those areas that we're starting to see with that, we're seeing in the oncology space, but could be expanded into, and we're probably seeing it, right? There's probably a whole heap of, therapists doing some amazing work across the globe within their communities, offering, programs or support services or cheaper services or volunteering for, or setting up practices with, minority groups, those that are less advantaged, that I think use a lot of those really similar principles.
For sure. I definitely want to have a deeper conversation with you about your aspect as a researcher, and kind of where that love of research kind of came from, because it sounds like you really try to base your work on evidence-based principles, and I want to know where that, if like research literacy was, like, if there was a bunch of it in your entry level, or if that was something that you've come to on your own outside of massage. Can you speak to that?
Probably more outside. This is where the acupuncture probably has been its most influential in my role as a massage therapist, is that, as I said, lifelong learner. I want to know more. I want to understand what I'm doing and why. I also have a really strong belief that was just intrinsic. It wasn't we didn't do any evidence-based practice really, in either of my courses, the acupuncture or the massage. But the idea that knowledge can help us in clinical practice. But with that, I think there needs to be a portion of that that's really relevant to clinical practice. So I have no problem with any research that's trying to understand mechanisms. It's hard to know how that will translate into practice when you're doing a mechanism, but that's fine. That's not the purpose of it. The purpose is a mechanistic study to try and understand what happens to A when you do B. And they are fine. And we absolutely need those, right? We need to have a bit of an idea of what happens to A when we do B. But I also think that, and maybe this has come from acupuncture, because acupuncture research does not always reflect acupuncture practice. So I think it probably happened because when I wanted to do further study, my option was very much limited to doing a master's of acupuncture, because there was progression within the acupuncture world. You finish your course and there's really no progression for further study unless you do like extra stuff like a cupping or a myofascial course, or, all of those sorts of things. Like, you do add-on stuff. Some therapists become other things. They become a reflexologist. Sometimes it's entwined in their course, depending on the course. But, they might become a hypnotherapist as well, or whatever. There's the progression for massage tends to go it tends to go out, not up. There isn't really many pathways. I don't know if that's the same, but there's not many pathways for massage therapists to become researchers in Australia. And so there was a pathway for acupuncture, and we did do some evidence-based practice within that. But there also was a strong belief that when you talked to people that were more academic, in acupuncture versus those that were clinicians, there was a very big feeling that the research didn't reflect what was actually happening in practice. I have always wanted my research to reflect clinical practice, but also to give people information to make choices, to make choices about care and to better inform them. And I don't know why. I think information's power for people, right? And I think it suits that philosophy of individualized care. You can then share what you know, that we know more about it. We can give people more options about choices and more options around things like consent. So I've always thought it's really important that research reflects, in part, clinical practice. Having said that, not every piece of my research will reflect it well. And parts of it only reflect a very small part of clinical practice, because it's not, I mean, obviously the women's health stuff isn't, with people doing sports, half of that's not going to be relevant to people who are, not seeing women who are pregnant or in women's health. But I feel like that research bit matters. And for me, I guess that capacity to be able to add to that evidence-based for massage is really important, because I think there are some amazing massage therapist researchers out there. There aren't a ton of them that I'm aware. If you look at the research data, I don't know, but my feeling is that the research being done on massage is actually being done by non-massage therapists. And I don't think Tiffany Field was a massage therapist. I mean, what she did was amazing for our profession in terms of getting massage to be researched over a really broad number of areas. I mean, her group was fantastic, and she absolutely, did what she could at the time in an era where there was almost no massage research being done consistently, and it's amazing. But I feel like, she and others have laid that groundwork for the rest of us. And now it's our responsibility as massage therapists, where possible, because we don't have a direct pathway into research, to be able to take it and evolve it in a way that perhaps does reflect more clinical practice. Because, I want to see more research being done by massage therapists, not research being done. There's quite a portion of massage research that's done by nurses, because massage also was part of nursing for a while. And it's not bad. It's just the way that and the settings with which they do it are very different to a way that a lot of massage therapists practice. So it's great that it's there, and it's good for if you're a nurse, but not so great if you're sitting in your own, because it's not a hospital setting and it's not acute, and it's so I would love to see more research come from massage therapists, or have massage therapists involved with, like, even if, the other areas, like the other fields, are being able to get grants and fund that research, that they include a massage therapist as part of the research team that helps guide research. Nikki Monk did an amazing publication where she looked at massage and had massage happen in a real world setting. And I think that's amazing, because I think protocols teach us a bit, but at some point, that's not how most of us work. I hope. That's not how most of us work. Most of us, don't go up the back 6 times, effleurage up the back 6 times and then move on to something else. Like, part of what we do is about what we feel. It might need 8 times for someone else. It might only need 2 for someone else. And so I'd love research to reflect the things that massage therapists think are important in their work. And then I think it will be more clinically relevant. And also, I think this idea of co-design is becoming more popular, that not just that you have people who've had a lived experience of whatever you're investigating involved in the study, but also as that encouragement for researchers to include massage therapists when they're setting up I mean, I would like to see it more involved in the whole design, but a big start would be don't just design a protocol yourself. Like, talk to an actual real life massage therapist who works in clinical practice and say, if we're doing massage for lower back pain, is this actually what you do? Like, because if it's not, we should probably try and change that so it suits and being, I guess, some understanding of research and the limitations of research would be helpful for people to know that you can't, you know, research is quite narrow. The research question is normally small because the broader it is, the more people you need and the more expensive it gets and the longer it has to run. And it's so understanding that, not everything's going to be amazing and perfect and an exact clinical match, but that there are ways that we can really, as therapists, really influence that without needing to have a master's or a PhD or those sorts of things. That getting someone who, if you're doing lower back pain and as a researcher and you're looking at massage, find that person that's really popular and booked out in your area or works for a sports medicine clinic and sees a lot of lower back pain stuff and bring them in and ask them to consult on the protocol. But it would be amazing if massage therapists could be more involved
Yeah, for
in
sure.
that space.
How did you get involved with, or what was your first introduction to the Massage Therapy Foundation, the IJTMB as well?
So someone at the association that I was part of mentioned that the Massage Therapy Foundation had a grant for massage therapists. And I just can't tell you how important that is. So grant money is stupid. I don't know. I'm assuming it's the same everywhere else. It is so hard to get. And where things are broad, and it sort of makes sense, right? Because we don't, as massage therapists, we don't fix things, right? Mostly we don't fix multiple sclerosis. We don't, you know, we don't fix dementia. We don't do all of that. We may have a role in some fall prevention, but that would probably be alongside some strengthening stuff that also needs to happen in fall prevention. But when you are in a really broad grant space, so in Australia, the National NHMRC, National Health NHM Medical Research, I don't know what the C stands for, but it's the big granting body. The categories are super broad. So you are competing against people that are looking at things for breast cancer or bowel cancer or any cancer, and then, dementia and heart disease and things that really have big impact on people's lives. It's super hard for anyone doing a massage to apply for a massage research project that's going to be judged well in terms of being able to get funding. I mean, it's hard enough already. Like, how do you choose? What do you do on a judging panel? Do you pick dementia over neurological conditions? I don't know. I don't want to be that person that has to pick who gets the grant and who doesn't. Like, and so I don't know that those avenues are the best place necessarily for massage therapists to get grants because it's super difficult. And at that point, if you are going, I think it's because you've got lots of research behind you and lots of evidence that this might matter and that you can make a difference and it's going to be cost effective and it's going to be impactful, but you need the research prior to prove that to get the big grant. So it might be you might go in as part of something else as a multidisciplinary treatment, but there is very few places, I think, where you can have a grant that massage is competitive and likely to do well. I think they're really limited. And so I think the Massage Therapy Foundation having a grant process allows people that step in to be able to do what I said, produce some of that prior evidence so that you can become potentially competitive for bigger, larger grants, where people are happy to invest their money with you because you're likely to perhaps give them an outcome that it does have meaningful impact. And it's not that we know that massage doesn't, but when you're competing with, improving or treatments for, dementia or any neuromuscular disease, MND, all of those things. I mean, we don't have enough money for those, right? So I think the Massage Therapy Foundation offers that really great space for some of that research to happen and to keep building. And so that's how I first heard about them, was someone at my association said, "Did you know?" And I went, "No, I did not." Um, so that was great. And really, I guess all of those things, the IJTMB, the Massage Therapy Foundation, all of those places and spaces, I think just require that constant promotion, unfortunately. It's probably the same with, the Society of Massage Archives, right? If you've never heard of them, it's not necessarily, someone has to mention it and then you have to be aware of it. There is now so much available, I think, on the web that it becomes hard to find stuff, and it becomes a little daunting to even know what term to put in to search for. And so I think it's great that there are some bodies around that really championing that. And I guess in Australia sometimes, I didn't learn about it it wasn't, IJTMB didn't exist when I was first studying. And I guess this comes back to this point where we don't come back to do any higher education, is that would have been the space I probably would have heard about IJTMB.
Oh.
And often it's a bit different now with open access, but initially I remember doing my master's and having to go around to 5,000 different libraries and photocopy articles from the library because we didn't have an electronic database. Gosh, I'm old. But it's changed so rapidly, right? That information is, maybe people going through their massage education right now will be much more aware of those things because it will be talked about that you can access these articles for free. Most of them were not open access when I started. You had to, the libraries of the university had to subscribe and they got paper copies. And that's why you had to photocopy them.
Yeah.
That electronics, that open access has changed things now. So I think perhaps searching for massage articles online is a different thing than it was. It wasn't in my remit really to go, oh, I should search for a massage article online. And even when you did, it's that horrible thing. You can have 24 hours of access without downloading it for $60.
Paywall.
And again, paywall, and we're back to that. Massage therapists in Australia are part-time, who don't earn a lot of money and don't have potentially the research literacy to even know which article to purchase that will give them the best bang for their buck, particularly if they can't read it. But even from an abstract, they don't necessarily have that research literacy to go, I'll spend $60 on this article, because you can't, like, if you need 5 articles, it's $300. That's a lot of money for a massage therapist to improve their evidence-based practice when they don't have access to, that's a different argument, right? Like, it's part of the general healthcare and across other fields as well. But the open access, more articles becoming open access, I think is going to change that. Again, we're back to information, that how people get information and how people can access it and then make decisions about what they feel they need.
What a blessing. Like you said, we need to talk about these things more to help bolster them. I think that's huge, actually. Is there anything more to be said about either the grant that you received from MTF or your role as an assistant editor for IJTMB currently? Is there more to be said about that before I guide us into shift our gears one more time before we go into closing thoughts?
Sure. When I submitted some articles to the IJTMB, I had an amazing editor, Albert. Hi, Albert, who I've never met, but other than through who I've never met face to face, but just through correspondence. And he was so kind in the way that he provided feedback and encouragement to in terms of publications. When I was, we're all learning, right? Research is writing a research article is really hard. Maybe not so hard with AI anymore, but it's really hard. It's the language is different, right? If you say that it's significant, that means a totally different thing in terms of stats than it's important. Like there's a whole language around how you write things, how it's used, the way you frame things. And so I learned that through doing and through some amazing people sharing their expertise and their knowledge to help me in projects that got published that really helped me become a better researcher. And again, still on that learning curve. But Albert was amazing. Like he really was so very kind and encouraging and supportive when I had questions. And that doesn't happen a lot with journals. IJTMB is in that really weird space that it's not a commercial entity. It's not making money it's not part of a bigger, like Elsevier or one of those bigger publishing things where everyone needs to make money. It's done in a way that the journal sits where it's that sort of that bridge between research and practice, and where people get encouragement and perhaps more support than they would if they published. I mean, I am an editor, so biased, but part of the reason I joined was because of that, my experience with the journal and that space for massage therapists again to start doing some research, because we don't have many opportunities, and the journal is a place where people can start, whether that's with a case study or something like that, where they can publish something that matters. May change how people perceive something or the way that they practice, or make them think about the way they practice. And so part of the reason I took that role on was because I got to work with some great people, but also I wanted to do that for someone else, because I think it's hard to know sliding doors, right? It's hard to know what would have happened if I got a totally different editor who was just like, no, that's rubbish. That, whereas I got currently it's not in the right format. If you wanted to, put it more in this format, then it's potentially publishable. So, and I could ask questions. I could clarify, what do you mean by that? Okay, now I understand. Got it. And it was great. That's super rare in the research world with journals. And so that's part of what I wanted to share, I guess, in that I think the journals, I think it's it's a stepping stone, and it's a really lovely thing that our industry has that is useful, but also helpful because we need massage therapists to review stuff. And I think, it runs with passionate people who are, whether that is the reviewers, the editors, it runs through that passion of trying to make a bit of a difference in a small way. And enough of us do that with all different things, and our industry is just going to keep growing.
All right. Awesome. Yeah. I'm glad that was your experience too, because look at you now. You had a great editor, and now you're assistant editor for the whole journal.
Well, there's two of us who are assistant editors, but I don't know if they would. But yeah, I think, but part of that comes because I did have such a great experience, and I think that's the mark that the previous editors in lots of different ways have left on it. And hopefully we can all, I can leave a mark in my own way for someone else later. I mean, that's, again, we're back to this wanting to make the massage space a better place overall.
Yeah, absolutely. If you're ready, I'm going to give you some rapid fire history related questions right before we go into our closing thoughts, okay?
Okay.
First of all, Are you involved in any collection or preserving of massage history in any way, whether that's books, stories, equipments, photos, ephemera of any sort?
No, research would be the only, my research bit would be the only bit that is involved. It's not history per se, but eventually it will be old enough, it'll be history.
It happens to everything, right?
Yep.
Okay. What do you see as the value or perhaps the challenge of keeping massage history alive?
I would say interest and understanding why it's important. I think when people are busy, particularly when they first graduate, they're trying to learn heaps. Most of us come out knowing a bit, but a lot of our learning happens as soon as we're in practice. I think it takes a while before you appreciate those sorts of things. You appreciate the history and why it's important to preserve it. So I think that getting people interested in understanding why it matters is probably one of the bigger challenges.
All right. Is there any way in your history that an understanding of massage history has shaped your practice, your philosophy, or how you show up as a therapist, Sarah?
Not explicitly. I think a lot of my role was defined by the evolution of massage. I don't, which of course is now history, because again, that was a while ago. But I don't know, not in that sense of that direct sense of looking back at something and feeling like it influenced. I think I am the therapist I am because people before me made changes. We're back to the Tiffany Fields of the world. And as I said, I had some amazing massage therapist teachers who were really passionate about massage and about the industry. It wasn't just a job. So I think those things have definitely made me who I am, and have definitely, where I am is because of multiple different people that I've encountered and shoulders that you get to stand on. So I think history matters from that point, but I don't recall any sort of area where somebody reflected something about history that I went, oh, and it changed anything. History was not the history of massage. Can't even remember really doing the history of massage in my course at all.
Yeah. Yeah. Uh, yeah, I think that's personally, I think that's unfortunate. I I think I think history is a connector and potentially a community builder. So, yeah, that's unfortunate, but it's not. Unfortunately, it's not uncommon either, right?
No. And I think again we're young relative to where we've evolved. Like it was probably more involved in nursing for a while there, and there was probably that separation between massage, I guess for more relaxation and just general wellness than treatment. And I think having that history, um, I think there's a much richer history in the last 20, I mean, just research wise, right? There's a much richer history than perhaps the 50 years before that, where it was still evolving, still useful, but wasn't. And there's probably some really important people that I just don't know about who've helped shape that, taking it away perhaps from nursing more and evolving it into something that's a singular profession as opposed to part of another profession that I just don't know about. And so that is a bit sad.
Yeah,
Yay for them. Good for them.
exactly. All right. Final five questions. These are our closing thoughts, Sarah. When you look back over the last little more than a quarter century, what are you most proud of in your career? What do you hope to be remembered for, perhaps?
Oh God, what a big question. Oh God, what a big question. I The study that we got the grant for the from the Massage Therapy Foundation did individualized care. And so people got the treatment that they would have if they just paid not a random massage therapist, but a professional massage therapist, normally. So they went to their clinics. It was literally, there was no protocol in this. There was a protocol, but it was about how you care for someone in the treatment, not what you do. And these were women who were pregnant after a loss, so after a stillbirth or a termination, and reading the impact. So we collected data on how they experienced the massage and how it had been helpful and what had happened. And reading some of those comments made me cry. Like, it was, those therapists were making such a big difference to those women. They were able to do more than survive a pregnancy after a loss, which is such a big thing. Like, it is such a big thing. And I just think that I'm so blessed that I had that opportunity to be able to showcase massage in its best. Like, it just felt like this is exactly what we're good at and exactly what massage can do. And it felt so lovely from a personal point of view to have that validated, because that's what I thought we could do potentially. And it was so nice to see it come back. And the comments were just literally so amazing, about how much impact that it had. And I think probably that's what I'm most proud of, which is not really me, right? It's other massage therapists. But it felt like we were researching what it is that we truly do. Like, all of it, the hands, the environment, the way we talk to people, and that we were making a really big difference. And that was super cool.
It sounds like it. A
Yeah.
beautiful experience. All right. Uh, if you could record one historical figure's account of massage, someone who is deceased, is there anyone that comes top of mind? Who would you choose and why?
Oh, God. They have to be deceased.
There is a flip side to this question in the next one.
Oh, I don't know. No one comes to mind who's deceased, who has had such a big impact that I want to go, why? Or what were you doing? Or how did you think about that? No one specifically, I've got to say, sorry.
That's okay. All right. On the flip side of that, who would you maybe like to hear on this podcast next? Is there anyone alive that you think should be interviewed, has an important story to tell? Bonus points if you can also, if they're Australian, if there's some cool Australian people I can party with here, Sarah.
Oh, absolutely. So there's an amazing, I think he's retired now. I'm pretty sure he's retired. There's an amazing massage therapist called Rob Granter. He worked with Essendon Football Club, or AFL Football Club. He was a contributor to the clinical sports medicine book that Bruckner and Kahn released. So that's why that's why there is a big there's a really important massage component to that, is that he was involved in some of that, getting that information into the book, and he did some postgraduate teachings. And I, personal, obviously, opinion, I find him so inspiring. His capacity to do those things, make you question what you're doing, to want to be the best therapist that you can be, to have that high level of understanding and training and individualized care. He's an educator, and I think he's made a really big difference in a lot of people's lives as massage therapists, because of the amazing educator that he is, and that level of professionalism, and really helping probably put massage in with those at football clubs, and having that level of professionalism and stuff. So He would be my, as an Australian, which I can definitely do. I mean, there's multiple other amazing people, but as an Australian, he would be, in terms of history, for me, he would be a big, like he's gone to Commonwealth Games, he's gone to Olympic Games as a massage therapist. As part of that, a part of the team, and yeah, contributed to book. He's just, I'm fangirling, but he's super for me, super inspiring. And whenever I hear him talk or speak, I just want to be a better therapist.
Well, good. Yeah, definitely. We could all use some more of that. Let's get him on if we can. All right. Final notes, Sarah, before we get out of here. Do you have anything that you'd like to promote? Is there any way listeners can learn more about you, your work, potentially connect with you, or support what you're currently doing?
Oh God, that's it. No, I don't want to promote anything entirely because other than that, I think amazing massage therapists are amazing, and I think we just need to keep doing what we're doing. I am more than happy to have a chat with people if they want to have a chat. Some of my research is open access. One of the things I love about researchers is generally when you contact a researcher and ask for their article, they will provide it for you for private use. So I always encourage people to reach out to researchers, myself included, if they're having trouble accessing paywalls and stuff like that. And I have I think because I have stood on the shoulders of other people, I think that it's important that, hopefully you become the shoulders for someone else. And so particularly around that research aspect, I'm more than happy to ask questions and stuff and answer questions, and stuff like that, because we've all got to start somewhere, right? And again, that thing around knowledge. If sometimes that information at the right time, like finding out about the Massage Therapy Foundation grant, makes such a difference. And, I think it's important that we, while most of us often work individually, that we are a collective and that we try and create those connections and things with our fellow therapists and researchers and stuff too, because I think together we are stronger.
I love it. Last thing, is there anything we didn't cover today that you would like to add? The mic is all yours. Feel free to hog it.
Oh no, God, I think I've done enough of that already. I've gone into some really, I think I've done heaps of that already. No, I think we've covered everything that's probably been important and I guess influential or pivotal in my journey as a massage therapist.
All right. Awesome. That's a beautiful button on it then. Thank you so much, Dr. Sarah Fogarty, for making the time, hanging out with us here at SOMA, and sharing your story with us.
My pleasure. Thank you for the opportunity to create or to be part of the history. It's awesome. I think you're doing a great job.
Thank you so much.
If you enjoyed this podcast, please consider donating to the Society of Massage Archives so we can continue to bring you this episode and other resources to fulfill our mission of preserving and integrating the historical knowledge of massage therapy's professional advocacy and traditional techniques to guide and enrich our contemporary practices. Thank you. You have been listening to the Hands of History podcast, a production of the Society of Massage Archives. You can learn more about the Society at societyofmassagearchives.org. We are also on Facebook and Instagram. Do you know someone whose hands have helped shape the practice of massage? If you or someone you know would make a great guest for future episodes of this podcast, please email the Society at societyofmassagearchives@gmail.com. Society of Massage Archives, all one word, @gmail.com.